Jeez. Wow, that's a lot of people. Ah. Eyes up.
Hey, team.
Hey, how's it going? Can you edit people from your current role?
I don't see anybody in the waiting room.
Okay, there's 11 people.
Oh, yeah. How are
This
you
is
going to
Meredith. I can admit people if you need me to, but
yes, please.
Well, where's the trainer?
We need Mark.
Oh,
Mark's not in the waiting room, and neither is the trainer.
No, Mark is the trainer.
Oh, okay. Mark is not in the waiting room.
He must
Okay.
have. Yeah.
I'm emailing him now. I think there's definitely confusion around who's got what.
Mm-hmm.
And just so you know, this is the 1 hour Zoom webinar, but it's actually supposed to be 2 hours.
Yeah, it'll continue going.
Okay, awesome. Thank you.
Are you guys, do you need me to admit folks?
Yes, please.
Good afternoon.
And let me get my slides up here too for the correct ones at least. Hi, can everybody hear me?
Yes,
Awesome. And we'll just give folks maybe 1 more minute to log on. And I see some folks are still getting connected here. Okay,
Good
perfect.
morning.
Morning. All right. Okay. So I think I think we're going to go ahead and get started if that's okay with you, Dr. Mark.
fine.
Okay, perfect. Hi, guys. It's so nice to meet you. My name is Zipporah Fuller. I am the Director of Technical Assistance here at NCUIH. I am one of the newer team members as I started at the end of July. And my role solely is just to help support the team and all the projects they currently have going on and just really ensure that our UIOs have the best resources, materials that you all need to continue to provide quality care. So I've been in healthcare a little over 15 years and I've served in various capacities. I also was at Native Health in Phoenix for about four years. And then prior to this role, I was a quality consultant to several IHS hospitals as well. So I've been in the game for a little bit, but I'm going to go ahead and be the host for this particular session. Next slide. So a little bit about NCUIH. The National Council of Urban Indian Health is the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. NCUIH is the only national representative of 41 Title V urban Indian organizations under the Indian Health Services and the Indian Healthcare Improvement Act. NCUIH strives to improve the health of over 70% of the American Indian Alaska Native population that lives in urban areas supported by quality, accessible healthcare centers. Next slide. So today's program, thank you guys so much for taking time out of your busy schedules to join us today. As we know, COVID-19 has really made a tremendous impact on our workforce, on our community members, the patients, as well as the funding that we receive to assist our patients in the best way possible. So we decided to create a series, a 6-session series with the umbrella theme of creating resilient board of director members in the era of COVID-19. So we're really hoping that this first one could just provide you guys with a refresher and also touch on some of the pieces that address the COVID-19 pandemic. As we know, a lot of us have never been in a pandemic before, or maybe this is, 2, 3 if you count H1N1 and the swine flu as well. But thank you guys again so much for joining. Today's topic is going to be setting the stage, best practices with Board of Director minutes, agenda formats, and bylaws. And Dr. Mark Clark, who is our Senior Program Manager of the Technical Assistance Department, will be facilitating or hosting, I should say, this call. So Dr. Mark Clark pursued his graduate studies at Howard University and earned a PhD in education at American University in 2004. He is a certified project management professional who has directed a federal program office serving 59 states and territories. He has served as a project director on federally funded health projects and directed school health promotion programs and offices in a large urban school district. He has also been involved in program design, evaluation, and intervention activities as facets of public health policy promotion and prevention project work since 1989. These projects have served all ages, spanning from home visiting programs for promoting infant mental health among first-time Latina moms to teen pregnancy prevention projects among tribes and tribal organizations. His background and experience demonstrate the capacity to meet the responsibilities, skills, experience, and education required for project management in the public and private sector. His experience with managing human services programs, research studies, and collaborating with federal agencies to support data-driven programs is extensive. Next slide, please. So I'm going to go ahead and turn the floor over to Dr. Mark Clark, but before we do, we just ask if you could please type in your name, your organization that you're with, and your tribal affiliation in the chat box. And just a brief overview of the outline of how we plan to approach the day. So Dr. Clark will go through his presentation, and we will have a 15-minute intermission break in between topic sessions. And we also will be facilitating a Q&A as well. So if you could please just join me in welcoming Dr. Mark Clark to the floor.
Good afternoon, everyone. And based on your time zone, it may be morning in some spots, but I'm glad to speak with all of you. And welcome to this opening session of our 6-session series. It's interesting in that it doesn't seem like the most exciting topic. It feels mundane, but I'm going to try and dress it up. Going to try and make sure that we understand the value of not only understanding effective meeting mechanics, but also recognizing the importance of creating good agendas, creating effective agendas, making sure that bylaws are observed, and the role that even something that feels like such a routine activity as taking minutes and sharing minutes becomes an essential part of what we do and what we facilitate as board members. It's all part of what you might call effective governance, and it begins with making sure that we're using effective mechanics as we understand the nuts and bolts of sound management and board governance. Next slide, please. The good place to start a meeting of this kind, and again, we want to maximize your participation. We're going to ask you to unmute from time to time so you can share your thoughts and reactions with us. But a good place to start is, about understanding meeting mechanics is to reflect on times that we've been in bad meetings. A meeting that you had to sit through, a meeting that felt like it was just slow torture, and to actually kind of think of what one-word description you might come up with to say what was wrong with that meeting. You know, the opposite of that, of course, is what made a good meeting. So I'm going to ask you to take a moment and put that one word into the chat box to describe that slow torture meeting that was really hard for you to get through, and describe what it felt like to experience that. Maybe you even were the person who convened that meeting. And as you reflect back, you can understand maybe errors you made in trying to organize that with meeting mechanics. So take a moment and enter in the chat box how you might describe that bad meeting. And Zep, I'll ask you to monitor the chat box so that we have an idea of what people are saying about what a bad meeting feels like to sit through.
So we've got people commenting unfocused, new to minute meetings. Some folks are just learning, long and unclear roles, and some folks feel uncomfortable.
Those are really useful reactions, and thank you for your feedback. The overriding theme about that lack of focus or the discomfort you feel in being asked to sit through a long meeting, and sometimes meetings that are too long. There are ways in which the agenda and how you set the stage for your meeting can actually anticipate and address those concerns. One of the most important ways is to understand what a good agenda looks like and how good minutes help make that happen. And of course, it's nice to have those things, but sometimes, you know, when you think of meetings you've been to, and you'll have an opportunity to reflect on this as well. The way in which the stage is set and our expectations sometimes just aren't met by how those meetings actually turn out. So let's understand how valuable it is to put some thought into that agenda. And we're going to give you some tips and ideas about what makes for a good agenda. We'll talk about some of the elements of good minute taking, and think of minute taking as a genuine skill and competency that you're going to look for in those persons you designate to be your minute takers for your meetings. I think the important thing to understand is, first of all, the role that agenda plays in setting the stage for an effective meeting, and how that can make all the difference in the world for your discussions and your opportunities to maximize your board members' participation. And in some respects, that's really what we're after here. You've selected board members for their wisdom, their experience, their maybe even their depth of training in a variety of disciplines, and you want to make get the most mileage out of their activity, out of their presence in a board meeting. So you don't want the mechanics of your meeting, even Robert's rules sometimes, as a barrier to how people participate. You want to make sure that you're getting the most out of those leaders and the skill sets that you actually recruited people to bring to the table. So good meeting mechanics can help you do that. Next slide. So what are some of the items of the mechanics of the meeting? Well, we're clearly setting the agenda is key. Once you've set your agenda, you've got to be careful to avoid last minute changes. We'll talk about how that might operate and some ways in which you can head off those last minute changes. It's important that if you're going to have reference material and reports and have discussions about decisions that need to be made, that you distribute materials in advance so that your attendees can feel well informed. There's nothing worse than coming to a meeting and feeling like you're the person who hasn't had a chance to do their homework, to understand what you're being asked to reflect on or to make decisions about. So that distributing materials in advance is really important. Now here's a key question. What about removing items from the agenda? Is that something that you should consider if you've convened the meeting and carefully assembled your agenda items? The answer is, I want to say it depends. And what you should ask for when someone is asked to remove an item from the agenda is that your minutes should document the request. You should make sure that the removal is at least validated by some reason other than a personal preference or even a comfort question. Because after all, if you've assembled the agenda carefully and reflected with the group in advance on what needs to be discussed, removing an agenda item at the last minute is the perfect example of making those last minute changes that you're trying to avoid. So that you want to make sure that, again, your materials are distributed in advance. Those materials that are distributed in advance should be carefully reviewed, and that and this applies to presentations as well, so that your board members are getting materials that reflect the effectiveness and efficiency of your organization. Remember, those written materials in particular are going to be around as a reflection of the quality of your staff and your staff support. So they should be high quality. They should be reviewed for not only for their content but for their format. And then finally, if you're calling the meeting and you're the meeting manager, then this idea of deciding who will manage the meeting is sort of a foregone conclusion. Many of you are probably contributing to agendas and maybe not setting the agendas. So we'll have tips and ideas for what are the contributions you can make as a member who may not actually create the agenda, but may have an opportunity to contribute to it. Next slide, please. So some more discussion about meeting mechanics. The outcome of having that agenda that's well thought out and a meeting that operates smoothly is that it facilitates good leadership discussions. So barriers to good discussion are the things you try to avoid by having a well-conceived agenda. If you're going to reflect on the work that's done outside of that meeting, and this is often a challenge, subcommittee work is a meaningful part of what goes into that agenda. You have to be careful on how you facilitate discussions about subcommittees. Keep it in mind that the review of the work of subcommittees is not an opportunity to rethink it or to have a second crack at arguments that weren't resolved. It really is not an opportunity to redo the work of those subcommittees. So if you want to make sure that your subcommittees remain meaningful, as someone facilitating that review of a subcommittee report, you want to make sure that you're careful about the boundaries of that conversation. It's not an opportunity to take a second crack at redoing the work of the subcommittee. And if you do that, if you make that a regular practice, then people who are part of subcommittees are going to feel devalued. It's going to lessen the importance of that subcommittee work. And ultimately, you're going to have problems with the effectiveness of your subcommittees if you take a second crack at their finished work and act as though everything they submit to you is a rough draft as opposed to a finished project. So that's in keeping with the same spirit of this final tip about meeting mechanics. You need to avoid conversations that get into the weeds of day-to-day management and operational challenges. Those conversations often are difficult to resolve, but there's also a place in the agenda where you can limit the conversation there. And we'll talk about some ways in which you can make sure that conversation takes place, but it stays in a meaningful place on your agenda. We'll talk about how to do that. Next slide, please. Now, these are some considerations, and there's a laundry list of them, but I'd like to reflect on just a few of them. They're all ideas about what you could do to an existing agenda or some considerations you might make as you create an agenda. Keeping in mind that the goal of the agenda and the goal of the meeting is facilitating the leadership discussions. Your meeting might, you want some considerations for doing that then are shown here. And what I'd like to do is I'm going to leave this up for a little while because I'd like all of you to have an opportunity to see each bullet and discuss a few of them. Transition time is really that idea of trying to be mindful of what it takes to go from breaks and to breaks. If there's sessions, if there's refreshments during a meeting, then being honoring the way in which people need to actually physically make those transitions, either from sitting, walking, restroom breaks, coffee breaks, all those things that need to be considered in how you create the time for your agenda, understanding that you're trying to maximize the effective use of people's time. What is a mission moment? The 1 minute memo, that's one of my favorites. We'll talk about the 1 minute memo as well. The mission moment is literally that space in the agenda where you remind your members that here's why we're here. It could be something as simple as, let's review our vision statement. Let's talk about our commitments as board members. It could be something as simple as maybe an oath of some sort that has been used in the past, but it's that opportunity to remind people, here's why we're here. So that's that mission moment that could be built into the agenda. I think it's a moment of inspiration to get a meeting off to a good start. The agenda should be mindful of objectives, the context of the meeting, because all meetings are not created equal. Subcommittee meetings have different functions than overall board meetings. So maybe there's a decision that has to be made. Maybe there's information that needs to be shared. So an agenda that is about sharing information could be structured differently. And that's something to be mindful of as you structure your speakers, your presentations, and even the time allocated for each agenda item. A lot of people will find that idea of allotting time for agenda items as an important way to make sure that a meeting stays on track and that you cover all the topics you're trying to cover and don't get lost in conversations along the way to your consideration, particularly of new business. If you've ever been in a meeting where that happens and the new business that everyone was there to instruct is shoved into the last 15 minutes of your meeting, that's a frustrating experience. So again, allotting your time and being careful of budgeting that time appropriately is something that a good facilitator must do. Creating names for the agenda items is just something that makes the agenda have meaningful chunks of information as opposed to a long laundry list. Well, I'll show you an example of an agenda that fails to do that. The sequence, again, going from the most important items to the first, just makes sense because you're taking advantage of your leader's time. Clearly, and as we're going to demonstrate later today, the need to take breaks, the need to be mindful of adult learning styles. And that's that, if you look at the bullet across from there, that fancy word andragogy. is an effort to be mindful of adult learners. That there are ways in which you can structure your not only your conversations, but your agendas and your consideration of topics that are mindful of what it takes to have adults go through an effective training, effective professional development, and being clear on adult learner styles is one good background competency to have as you do that. Evaluating the meeting as a last minute item. I think one way in which you do that is again, you're mindful of budgeting time, and that question and answer session at the end, that open mic moment is an opportunity to ask members to reflect on how did this meeting serve your needs and what could we do to make it better. I think it's also a nice way to engage your attendees at a meeting in the same way that the 1 minute memo is. Now the 1 minute memo is sort of a trainer or educator trick where you literally ask a key question that you want everyone to reflect on, and literally say you have 60 seconds to jot down your answer or what this question that we're passing around evokes for you, and you ask people to have the response to that 1 minute question, but also one idea that what it evokes for you stimulates. So it's a two-part question. What do you think of the question on the paper? And what does it make you think in regard to the challenge of the board or this board meeting? So it's an opportunity. It really is an assessment tool. You can choose to process that on the moment, but that might not be the most effective way. If we were face-to-face, a 1 minute memo literally could be a 3x5 file card that you place in front of each person in that U-shaped meeting room. Ask them, hey, take the next minute to reflect on this question, and we'll collect your answers up. And that could be, it could take the place of a suggestion box, but it's an idea of keeping people engaged, not keeping people as in a meeting that is a monologue as opposed to a dialogue. So it's one opportunity that you build into your agenda to get feedback from people. And some people are more comfortable with their feedback in that written form. So that 3x5 file card as the 1 minute memo could be a useful tool for that. Another idea to consider on jazzing up your agenda is if your agenda is overladen with reports from a wide variety of subcommittees, then finding a way to minimize reports could be useful. There are ways you can do that with what is called a consent agenda, for example, or other kinds of limits you can put on oral reports during your meeting, all in an effort to make sure that the agenda is not overcrowded, but that people still have quality time to reflect on really the important contributions subcommittees might make. So making sure that you're mindful of how much time to devote to meetings is important. Obviously, the room and the setup for the room, the temperature room, the comfort, the location of the room. Is your room accessible? Do you have members where that you who might have problem with stairs? Are there all sorts of considerations about the physical setup of the room that could be really, really mindful? Again, temperature, ventilation, lighting, all those things come into effect of contributing to the quality of your meeting. Obviously, the role that refreshments are going to play. Again, we talked about transition time to address refreshments. And again, the idea of keeping adult learners in mind. Now, if we were together and I put that 3x5 file card in front of you, and you could look at this list of all the kinds of ways in which you could alter or jazz up your agenda, why don't you take a moment, we'll call a 60-second 1 minute moment, and pick out one of these bullets and enter it into the chat box as, this is the suggestion I'm going to take to improve our agenda when it's time to talk about our board meetings at home. I'm going to pause now, let you reflect on these meeting considerations and pick something that you would put in the chat box. Say, this is what I'm going to try when I get back in terms of jazzing up our agenda and making our meetings more effective. This is the idea that really appeals to me. Just take a moment and reflect on that.
Awesome. So we've got Laura who had commented, I love the idea of having items on consent. Thank you for the suggestion.
We'll actually talk about a consent agenda and how that operates. Are there other items that appeal to folks in the audience? Evaluated the meeting as the last agenda item. I think that really is a good one. It keeps us mindful of we can always constantly go through a cycle of improvement and innovation. Minimizing reports. This is a suggestion that resonates with me. Too often reports from each person disengages all of the other individuals. That's a good one. The mission moment is very important. I love that comment. Minimizing reporting. And again, some of these ideas you may have heard before, but they're just considerations for what you could do. Literally the next time it's time to set up an agenda, it's something you might want to consider when you plan your next meeting agenda, or you're in charge of setting up the mechanics of a meeting. Next slide, please. So a model agenda, what are some of the key things it should contain? You know, every meeting has minutes from a previous meeting. This notion of reviewing documents in advance of their being shared just suggests that the minutes must be well written. You've gotten rid of typos. You've made sure that they reflect the format that you've chosen for your minutes. We'll talk about formats later on. And if there's a CEO report, keep in mind that there may be the necessity for an executive session. If that occurs, then maybe that really is a meeting that should be planned for, as opposed to taking up the space of a board meeting. Executive sessions sometimes are necessary, and if that's how your CEO report is delivered, that's a practice that you may want to consider in your meeting plans as well. Maybe a subcommittee of the board meets in executive session with the CEO for routine reports. That's again. It could be a facet of what a consent agenda consists of. Again, we'll talk about that in a moment. The information material, let's be clear on this. Your meeting is not an opportunity for recitation or reading. So I would really hesitate to ever have some read aloud moments from materials or conclusions from subcommittees as a facet of what's reported. The information material should have been read in advance. And so be careful how you use the board's time if you're going to read from reports at all, or if you're going to have minutes devoted to silent reading of material because you really want to ensure board members had an opportunity to review a report. Keep in mind how that might lose the attention of some folks who did their homework and read the stuff in advance versus the people who didn't read it at all and really need that 10 minutes to see the report that you're referring to. So just be fair to all the members who are in attendance. And of course, that applies to key reports like audits and other kinds of complex reporting. It's important to understand that where needed for those reports, if you're going to have staff on hand to clarify findings, that might be a very useful way to have reporting done by the expertise you have available to you, as opposed to just hoping folks can figure out the reports that they were sent in advance. So having staff available to respond to questions and answers about the findings of a report might be really important, particularly for financial and budgetary information. And a lot of people sometimes find it difficult to translate those kinds of documents. As a matter of fact, we're going to talk about budget documents and finance information for non-financial folks in one of our sessions coming up in this series. Next slide, please. Other things in your model agenda, keep in mind that the decisions that are recorded by the board are not based on transcripts. They're not based on recordings or direct quotations. That's why your minutes are important as a reflection of decision and action items, not a record of everything that was said. Again, be careful to avoid redoing the work of subcommittees. That not only does it undermine the value of the subcommittee's work, but it robs those meetings of their importance. If you make it a practice to redo subcommittee work, eventually your subcommittees are not going to have well-attended meetings of their own, because they won't feel like their time is being well spent. The way in which your agenda models organizational policies, plans, and documents that you're asking people to be aware of that need to be read in advance or approved. Again, we'll talk about what a consent agenda consists of, but the idea is that you should not devote your meeting time to editing, proofreading, or going over a policy statement. If it needs to be redone, if there's confusion about the wording and language, then send it back to the folks who did it, as opposed to trying to edit it and use the valuable board members' time for that kind of typical, in some respects, mundane work of language construction, sentences, and editing in that way. A good proofreading should help you avoid that. Sometimes an attractive feature of a board meeting could be to have a very short in-service or training session. If that's a practice that your board uses, then trying to use that time effectively with an in-service on a topic that is meaningful to the board, or it might be of critical importance. Obviously, COVID and the coronavirus come to mind as topics that have driven a lot of conversation by decision makers and other folks. In-service trainings about the rank and file needs, the work in the trenches within the health center could be important. But again, be judicious in how you use the board's time if you're going to set aside time for training. Next slide, please. So we've talked about what a consent agenda is, and as a matter of fact, it's used often enough that I have an additional handout that might be meaningful to folks that we'll share as a resource. Consent agendas are meant to deal with routine items that may not require discussion. As a matter of fact, if they require discussion, they should not be on your consent agenda. One example of the kinds of issues that could be in the consent agenda are reports that reflect data, that share tables, that again are meant to maybe even be an at-a-glance kind of document, as opposed to a wordy, lengthy narrative. Items that do not require discussion could easily be moved to the consent agenda, and so in that way you avoid taking up board time. Be careful with that use of the consent agenda, in the sense that you have a wide variety of competencies and experiences among your board members. Assuming that everybody can translate the meaning of a balance sheet or an income statement, or that everyone understands some of the accounting jargon that might be part of a complex financial report, it may be unfair to some members. So the notion that data speaks for itself is misleading. Data rarely speaks for itself and often needs to be translated for folks to get the maximum value of it. So be careful on what you consider as mundane information that should go to the consent agenda, because the notion of the consent agenda these are items that do not need to be read, and so they're so mundane and so everyday. You're letting your board members know that a new policy was suggested, but read it at your leisure. You don't need to read it to make a decision on it. So consent is implied by putting it on the consent agenda. Now there are limits to how you use that. Audit findings and recommendations, again, those could be referred to, but not necessarily reviewed in the context of a meeting. Financial reports, particularly ones that are significant, may or may not be on the consent agenda. Again, I think you want to be careful on the complexity of the information there. And then committee decisions that were decided on by a subset of the board, the executive committee, may need to be memorialized by being part of a consent agenda. It's not, again, the idea is that it's not an opportunity for a subset of the board to have decisions ratified, because this is not about ratifying decision. The decision to create the consent agenda is where you've already decided in advance what's routine, what's mundane, and what we could just agree to automatically, as we don't need to take a look at this in order for it to transact board business. So that's the way in which a consent agenda could be used. Some reports could go there. Those non-routine reports that are maybe about problem solving or really urgent matters probably don't belong on the consent agenda. A treasurer's report, a report that is just an update on data that you've already seen or gotten, about patient visits, about the waiting room, about changes to other kinds of supply chains, those kinds of things. Those might be things that you want to notify the board about, but you don't need to take up the board's time. So that's the consent agenda. Next slide, please. So what shouldn't be on the consent agenda? And what should be? A little bit more about consent agendas. Routine, standard, non-controversial, and self-explanatory items may be great candidates for what you can move to that consent agenda and stop wasting the board's time with looking at routine matters. What are some of those things? Previous board minutes could be done by consent if people are reviewing them in advance, and if there are no changes. Minutes in and of themselves probably are not controversial. There may be board controversy that is reflected in action items that minutes discuss, but the minutes themselves should not be controversial. Does that make sense? Zep, what do you think? Does that make sense?
Sorry, it wasn't allowing me to unmute. Yeah, absolutely.
Yeah. There's a different issue for the board. If your minutes are full of controversy, that's a challenge that we don't have time to discuss right now. So some examples: financial reports, procedural changes, policy revisions, updates to documents that have been previously approved and considered by the board or the board subcommittees. Even contracts that are sort of standard contracts and not one-time only deals. Revisions to those contracts, changes to those contracts, changes in terms. That would be those would be great examples. Now remember that there might be an interaction between the consent agenda and board bylaws. You want to be careful that board bylaws don't become something that are open for review over and over and over again. But the consent agenda and what belongs on it could be a topic of conversation. And here's what's key about the consent agenda. If there are any members in attendance or on the board that have the suggestion that this item doesn't belong, you really have to hear that member. That's not a conversation you can avoid. So any one person attending the meeting could raise their hand and say, hey, I don't think this should be on the consent agenda, and here's why. So the consent agenda is not ironclad. It's meant to be flexible. Again, we're not looking for ironclad ways of stopping decision-making conversations. We're looking at what promotes good decision-making conversations. Next slide, please. So here's an example of what a consent agenda might look like if you had the agenda as an attachment to your board agenda. It might simply reflect a couple of tabs. Here's what we consented to not talk about. It might be in the form of reports, that are routine reports or updates to an existing report, as you see with some of these titles in this consent agenda example. Previous minutes, again, a routine report. Those could all go on the consent agenda and save the board's time. Next slide. Now, we're getting close to break time. It is about 1:43. We promised to have a 15-minute break. So we're definitely going to carefully keep track of our time. But I wanted to show some sample agendas as we had promised. And this is an interesting example because it's an agenda that we're actually using. And I'll show you why it's interesting. And this might be more useful for committee meetings, but it has all the elements of the agenda that are suggested as being there. It has the meeting title, it has the date and time, and if you look carefully, it reflects who's in attendance with initials down at the bottom. And look at the agenda itself. Begins with an opening and a welcome, a room for projects, discussion, and updates, and then topics that may belong as again at the behest of the convener of this meeting, and finally an adjournment. So it has everything that is in a routine agenda, but what's added here is a section that says let's record the action items. Let's record key points that are made in discussion, and let's assign due dates. Let's talk about tasks. So this is a very action-oriented sample agenda. It's as a matter of fact, it's a format that we use at NCUIH, and it's a very helpful way of organizing your meeting agenda, your meeting minutes, and keeping it all in one spot. So this is just a sample agenda format that we've found effective. Next slide, please. Here's another sample agenda. I'm gonna ask you to take a look at it and look at its structure. It does have key elements of an agenda, but is it an agenda that you would find useful? And you could open up the mics or the chats or whatever. I'm just curious on how people react to this particular meeting agenda. You can unmute yourself if you have a comment to make, or you could enter it into the chat box.
Hi, this is Shannon Parker from North American Indian Alliance.
Hi, Shannon.
Hi, and so I'm in a position where I'm the new ED, and so I'm kind of viewing this from the ED lens as well as a board member kind of lens. So on this agenda, I don't see where there is an ability to, like, say, new business, old business, things like that. So
right.
I'm just a little bit it's outside of what I'm normally used to seeing, but that's good because I'm open to new things. But
right.
How does this compare to what you might see as a standard meeting agenda?
That's a good question, and other comments, of course, are welcome. I think one of the things that to me is the most eye-catching is the length of that discussion items. You've got discussion items that go from what is it, A through M, and if there's that much discussion going on, either this organization needs subcommittees to do work outside of the meeting, or the person who is creating the agenda isn't very imaginative about grouping these ideas. One of the things that you've seen in other agendas, and we'll show you a more effective version of this, is there's a grouping that makes sense so that the items are sectioned off in phases for discussion, so that discussion can come to an end. This agenda would be so intimidating to see in advance, as we're going to be talking all night long. I don't know what we're going to resolve. And so one of the problems with the way in which it's organized is that it doesn't seem to have a section for resolution and action that resolves discussion. It seems to invite a lot of conversation, and it doesn't offer a guidance to the minute taker. And think about this. A good practice, a best practice for taking minutes is that you follow the order of the agenda to have the discussion follow the logic of how that meeting actually unfolds. So if you were to try and follow this discussion by use of it, or this meeting by use of the minutes, there's literally only one section that has all of the action taking place. And it seems like it would almost call for transcription or as a way to keep track of what's going on, or else you have A through M decisions to be resolved as action items. And that's just too much to ask of your note taker or your minute keeper. So the person who set this agenda up wasn't mindful of the need to have the agenda be a guide for the person keeping track of minutes and action items. So I just think it's a poorly thought out agenda. That would be my comment of it. And again, someone made the observation, it looks like there's way too much discussion to be had at this particular meeting. Next agenda example, I agree, some of those items could easily go on the consent agenda. Now, this agenda example pulls together some of the items we've discussed as good practices. It has timed sections. It has titles for sections. It has the information chunked in such a way so that it's a meaningful guidance for a note taker, so that the treasurer's project has its space, old business has its space, new business has its space, the room for other topics and even other business. And it even ends on a note of discussing plans for the next meeting. So there's a sort of arc to the information. It has a starting place. And just like all the other agendas, it has attendance, it has date and time, it has location. But look at how it has a kind of logic to how it breaks up people's time. And then it even has a guide for here's how much time we're going to devote to each of these topics. So that I think this is the kind of agenda construction that could really help with moving up. If you've had a meeting that is, if your processes where meetings become overlong, meetings feel burdensome, they don't feel like they move because a person is either not facilitating it well or not being a good timekeeper of discussions. This kind of commitment to the timing for the elements of the agenda could be really useful. It says it communicates to your attendees that we're going to be mindful of your time and respectful of the time, so that we don't wander off down dark alleys and get lost in conversations, but we have action items and resolutions. And again, it tells the minute taker, here's the important stuff to keep track of. So I think this is a very useful format for an agenda.
This is Shannon again, Shannon Parker. So I really like this layout, and I think one of the observations that I've made is that the board meeting is rather unfocused at times. I think this layout keeps it focused and keeps it moving along in a way that the board meeting sometimes doesn't do.
Yes. Yeah, I agree wholeheartedly with you. And I think that addition of having time limits for discussion items is a useful reminder to whoever is in charge of facilitating as a timekeeper that you need to get through all of your topics. You know, you don't want to shortchange the topics at the end of the agenda. If you'll notice, this particular agenda follows a practice that you see on a lot of meeting agendas where old business is discussed initially before new information. And I'd see a question in the chat box about minute taking. Here again, the agenda and previous minutes are great guides for whoever's in charge of taking minutes for the current meeting. And we'll talk about how that can play out when we come back from our break. Next slide.
And I just wanted to add a couple comments too for those of you guys. Could you go back to the previous slide?
Yeah, please. There you go.
Awesome. So just some, I guess, Robert Rules of Order tips that you might want to follow as well is that you want to make sure you also include a roll call and introductions as well, maybe after the call to order. And then also making sure that you approve of your agenda. That should also be an action item for your board of directors members. And then, of course, adding in there the approval of any previous minutes. And then the general layout too would be to include a CEO report or executive director report out. And then, of course, creating space for the consent agenda and also making space for any standing committee report outs. And usually there's probably between 4 to 5 different standing committees within boards, as you guys already know. And then moving down to the old business and new business, and then any community discussion and announcements that are coming up, because, you know, sometimes community members offer suggestions or what have you as well. So just kind of building in those additional Robert's Rules of Order components. And then also just making sure that everybody does have a moment to report out for the subcommittees that they're representing as well.
Zeb, can I get, this is Rosanna. I have a question about when you had mentioned the board approves the agenda, that's an action item. Does that happen before the meeting starts or
Yes.
like a couple weeks before? Or what's typical practice?
So typically what happens, and I can take Native Health for example, and thankfully we do have the minute taker on the line as well. Sorry to put you on the spot, Cherie. But Cherie does a really great job of sending out the agendas well in advance, in addition to any items that need to be read, such as policies, the standing committee report outs and what have you. So everything is packaged already, being sent out. And so what then happens is after the roll call and introductions, the group approves the agenda for that particular meeting. They get an action for approval, and then they move into the actual meeting and then follow that format. They approve the next or the previous month's minutes and what have you. So again, that's just the general Robert's Rules of Order components.
Okay, thank you. I appreciate that. And then
Sure.
if there's time, if I could ask about, I know I put it in the chat, I guess the designation of minutes, but I don't know if this is the right time to talk through it.
Yeah, absolutely. So I'd asked for folks to also chime in. Again, for Native Health, the CEO or COO administrative assistant would schedule the meetings, again, create the agendas and send those out as well. And it
Okay.
looks like you had mentioned that your board secretary takes the meeting minutes.
Yeah, I've been on other committees, and actually one of the committees in my work, I am a professional staffer for a committee, and so we're the ones from the organization who takes the meeting minutes. And so it's just a little bit different, I think, coming into a new environment. And so I was just wondering what typical practice was with urban Indian organizations.
Yeah, and we can maybe even have Laura and Carol also chime in and comment too. I see that Laura had mentioned that their board secretary designates the CEO's administrative assistant as well to take the minutes.
Okay.
Native Health, the CEO admin assistant does too. So please feel free to take yourselves off of mute, guys. And again, please feel free to chime in.
Okay, thank you.
Are there any other questions, comments? Carol or Laura, did you want to comment to Rosanna?
Yes, this is Carol. I did put in the chat that actually the executive committee meets a week prior to the board meeting, and they do discuss the agenda items that need to be put on the agenda or need to be discussed during the actual board meeting. And that has been really helpful to make sure that, the things that we really do need to discuss are not left out and they're added to the agenda. And then, of course, Cherie works directly with the CEO to get that agenda finalized and sent out. And Cherie does a really good job at getting all of the items that are going to be reviewed by the board out in a really good time so that everybody has time to review all of the items that will be reviewed during the board meeting.
Thank you, Carol.
Hi, this is Cherie. Can you hear me?
Yes.
Yes, just like Carol said, I do work with the CEO, which also is, the board is his boss. So I kind of work with the board constantly. I kind of know what they're doing. I know what's coming up. So getting information to them, I usually do it. Our meetings are on Tuesday, so I give them the weekend. I send it out on Thursday or Friday, so they at least have 2 to 3 days to review it, look over it. We've also set up like a separate folder where a link that the board members can look into the folders where I drop everything in there, where they can see it, review it over the weekend. I email it to them, so I make sure they have it. I've also, if they need it, I maybe send it out via just regular mail. Just keeping up on that. And regarding the minutes, going into the consent agenda, I know we have to approve them and sign them because we do get reviews like by IHS and Hersa, and they're always asking for the signed minutes, So we do keep those out. We do approve them. They're not like, even though they go really quick and they're really reviewed, and the majority of the time they don't need approval, but we do kind of take those out of the consent agenda.
If I may add something, this is Laura Juarez. Our CEO's administrative assistant, he places items for us to review 3 days to a week in advance on our board network. And so we can go in at any time and review those items before the meeting. It helps eliminate a lot of time having to review items during the meeting. And our bylaws, the board bylaws, allow us to designate someone to take these minutes for us. So our secretary chose to have the administrative assistant of the CEO take the minutes for us.
Excellent.
Great, Laura.
Go ahead.
Sorry, Mark. Yeah, thank you, Laura.
You're welcome.
I really appreciate your feedback, everyone. It's really useful to understand how other boards are operating to get a kind of sense of what practices are working for everyone. And it's good to see that people are making use of items like the consent agenda to make their meetings operate smoothly. So this one slide, we got to the next slide is, I believe, next slide, please. There you go. So that's our question slide. Next slide. Okay. It's the let's take a break slide that you've all been waiting for. We're right at 2 o'clock Eastern Standard Time. So we're about halfway through our training session, this particular series. I hope you enjoyed the second half of our series. Please take a few moments to stretch, maybe get a refreshment or two, and come back and join us in 15 minutes. We're going to put the timer on, so we'll see you in 14 minutes and 59 seconds.
Hi guys, I just wanted to chime in and let everybody know that we were almost to the 15-minute mark. And as people are returning, I just wanted to let everybody know that these slides will be available later. I'll be sharing the link as to where our Board of Directors trainings will be housed. So just be on the lookout, as well as going over some of the upcoming sessions. They are exciting, so just stay tuned. Absolutely, you're welcome. Perfect. Let me just make sure, let me go through my little window of seeing everybody's beautiful faces. Let's see, make sure that everybody's back. Yay, hi Leah, hi Melissa. Welcome back, everybody. Perfect. All right, so it looks like everybody's starting to return. So we can go ahead and get started with the second half of our session. So moving into these next components, is going to be a good engaging piece. You guys will be moving into an exercise right now that Dr. Mark will be facilitating. So I'm going to go ahead and turn the floor back over to Dr. Mark.
Welcome back, everyone. As you can see, the current screenshot captures our theme for the entire training and our focus on resiliency for board members, particularly in challenging times. It almost has a timeless sense to it. Working with populations like we serve and families we serve, it feels like every time is a challenging time. We sometimes feel like we move from crisis to crisis. A struggle for human dignity, civil rights, equal opportunity, however you frame it, feels like a long distance run and not a sprint. And so that struggle to be resilient in the face of challenges is one that we've adopted as, in some respects, a lifelong mission. And passing that on to our sons and daughters, families, to create communities that can withstand challenges is really important. And that's, we're reminded once again of that problem in this era with the coronavirus, the need to be resilient, and how do we foster resiliency with one another? That's key. And we're gonna address that topic more directly with sessions that are coming up. So I'm looking forward to what we'll learn with one another and this co-creation of a understanding of how we can be better at what we do. Next slide, please. We thought it would be nice to sort of come back from a break with a mental exercise that we call a board challenge. And this exercise is about when you go back and you think back to your board, I want you to reflect on two things you would want to do to make your board more effective. Now, we've been discussing meetings and agendas. We're going to talk about minute taking as well, but the challenge is not only the desire to make it more effective, but what step you could take to accomplish that. As you reflect on that, take a few moments, and you can enter your reaction to this mental challenge, this mental exercise in the chat box. So we ask you to take a moment to be reflective.
I think it would also help to reflect back on what some of the issues were that some folks had mentioned a little bit earlier.
Some of the descriptions of challenges with board meetings was that they were unfocused, that sometimes the meetings were long and the roles that people had in the meetings were unclear. One observation is that the meetings are uncomfortable. And another observation that they're too long. A lot of people felt that they were too long. And that captures some of the earliest reflections about the critique people had of meetings that they'd been part of, particularly board meetings in this context.
We also have Jeffrey Axtell commenting efficiency and preparation by board members is one thing he would change. And also from Laura, time of meetings, not in the evening when we're tired and trying to stay focused on the agenda. I think those are definitely great comments.
I love the observation about Zoom fatigue. I think being considerate and mindful of Zoom fatigue, especially when other board members have full-time jobs or community commitments. Zoom fatigue is a nice way to capture that. I'm new, but I would like to see more new members. We actually have a great team. I think we could do quite well. That's excellent. And this, again, a challenge of the moment, the use of the meeting platforms and digital electronic ways of staying in touch with one another offers challenges of its own that add kind of a different take on what meeting mechanics look like. The challenge with accomplishing board changes to the board, whether you're the person who convenes those board meetings or you're just advisory to the board, is bringing ideas, bringing new notions. Here's how, and literally it's often a question about here's how other people are doing things. It's something we might want to consider. One of the very attractive and wonderful things about being part of NCUIH's TA team is the way in which we're framed as a learning organization. We are flexible in that way, learning as we go along and trying to always spark innovation. So the challenge is being open to new practices and new ideas and not being afraid to make changes. The answer to some board minutes and traditions is that, well, this is how we've always done it. That doesn't seem like the best answer in these days, because we are challenged to be better and to do better in a time like this. So we started off with a mental challenge. Let's finish our last chunk of information and move ahead to our next slide. Thank you everyone for your contributions to the chat box. A general principle for board committees, and we'll talk about why board committees and bylaws go hand in hand. Are the board or meetings going to be, or committee meetings, are they monthly? Are they quarterly? Meetings that have an operational purpose or strategic planning. Strategic meetings literally might be in the form of a retreat where an annual strategy planning session might be a one-time, only one-off. Those meetings call for different strategies, but that's, again, an idea about board committees and subcommittees and how they operate. Another key question for subcommittees is, what is the relationship of subcommittees or subcommittee heads with overall management? Are they staffed by members of the UIO or by or are they staffed by volunteers? What role do they play in with the hierarchy of leadership within the UIO? Might be a key question to ask yourself for how subcommittees relate with one another and their capacity to work with the day-to-day staff. Subcommittees, of course, should always be honest and disclose in their discussions. Candid, forthright discussion is really what makes these meetings meaningful. If there's a board meeting or a subcommittee meeting that doesn't feel like it's a clear discussion of the challenges that subcommittee is asked to address, or in other ways there doesn't feel like there's an open sharing or the atmosphere isn't conducive to sharing, can be a really challenging session to be part of. And again, if you want to have your subcommittee members engage, you've got to set an atmosphere that makes it attractive. That goes hand in hand with the notion of being transparent in terms of our information, so that we're sharing good, valid information and really not discussing anecdotal or even gossipy reflections of the internal operations of the health center or any organization we're part of. Again, a principle for a subcommittee that doesn't have good minutes of its own activities is not going to be very useful. We'll talk about what good minutes look like. And then finally, reports to the board are a clear part, often mandated by bylaws, of what subcommittees should be doing. Particularly those standing subcommittees, they might have a routine reporting responsibility. I think it's essential that there should be some kind of periodic self-evaluation of committees and committee structures. If they're ineffective or they're not serving their purposes, an annual self-evaluation can create a time for honest reflection on committee structures and subcommittees, and be an opportunity to look at how to reorganize those committees, or maybe even look for new subcommittee leadership. I think it's important, though, that be done routinely. One tip is about understanding the regulatory agency standards. It's key that we understand what the accrediting agencies expect for us when we talk about our board governance structures, in particular what we document as the activity of those meetings, and that goes back to the minutes and well-kept minutes. Next slide, please. So how do bylaws impact this? The bylaws that we operate under help determine the structures of the organization. The bylaws are often available they must be available for review with accrediting agencies in particular. They help determine the rights of people who are involved in these structures, whether we're talking about employees or board members. The bylaws address how you function as a member of the organization you're part of. And so finally, the bylaws should just discuss procedures and in some respects regulate your activity as a member, not only of the board, but again, in a reflection of the board's relationship with the UIO that you serve, particularly about rights and duties, but there are also boundaries and limits on rights. So the bylaws address all that. Next slide, please. What are some bylaws do's and don'ts? And these are tips about best practices with bylaws. And we're going to share some resource information on bylaws at the end of the slide. So there'll be some links that you'll have access to with this slide set. What are some do's and don'ts? Bylaws shouldn't include information that changes frequently. The need to constantly review bylaws would be a challenge for any organization, but it's a diversion from being focused on the day-to-day challenges or the challenges that we're facing nowadays, to be involved in that kind of effort to undo or redo structures, bylaws would be I'm not going to say a waste of your time, but time poorly spent when you think about only a few meetings per year that you have access to that expertise that the board brings to the table. So information that changes frequently shouldn't be enshrined in the bylaws. An example of information that might change frequently might be policies, changes to the seasonal changes, how you react to programs and campaigns. A good example is we're involved in a get out the vote, get out the census effort. Census happens every 10 years. There's absolutely no reason for our bylaws to address that involvement, because we don't know how we'll be positioned in the next time that those seasonal opportunities present themselves. So policies about how you would address campaigns like the census or campaigns like voter registration might make more sense than bylaws that sort of serve as a straitjacket that make you respond to certain predictable seasonal events like elections or other opportunities. Budget formulation comes to mind. Our capacity to be responsive to budget formulation may alter dramatically by what we're facing and what we have faced as organizations. So to enshrine a response to budget formulation in bylaws would not make sense. You would address that in a policy document. So policies could change more frequently and are more easily amended or even rescinded than bylaws. Bylaws are not meant to change frequently to address those kinds of challenges. I hope that answered the question. Bylaws shouldn't be too ambitious. I'll give you an example of an ambitious bylaw. If you have a board or subcommittees that have trouble achieving quorums, and your quorum calls for having 85% of the members in attendance, that's an ambition that doesn't make sense if you know only 50% of your folks are showing up. And so you have to be practical and honest. So bylaws that are based on hard to achieve criteria for performance, bylaws that are based on a kind of optimal high peak performance that it's hard to achieve, might be too ambitious in their vision. They might be more aspirational than practical. So again, being overly ambitious in terms of what bylaws expect an organization to be capable of doing is what you want to be careful of. How regularly do you review your bylaws? Well, it makes sense to at least think about a review period that encompasses not only keeping into account board member terms of service, but every 2 years seems about reasonable for a review. But because this duty is going to be ongoing and should be driven by the results of a previous review, it makes sense to have someone who is a long-term party to operating under the bylaws. I think the responsibility of the executive director might be that keeping track of that revision process. So having someone who has that commitment that spans the terms of individual board members or even the chair of the board makes sense. So I think having the executive director charged with that review responsibility makes a lot of sense for bylaws. And then finally, the culture of the organization is meaningful. Bylaws are not meant to be a straitjacket that talks about what's disallowed and creating boundaries. They're meant to be a strategy for how you accomplish what you need to accomplish. You should take into consideration the number of people who are managed by an organization, the expectations and attitudes of not only the people to be managed, but the members, and then again of the community you serve. The culture of organizations, again, and I described our NCUIH as a learning organization. Organizations that are open to innovation, that are practical, and at the same time flexible and fluid, might have a different set of operational principles than ones that are bound by traditions and have lengthy histories or traditions that are meaningful for the members of that organization. So keeping in mind that what people are accustomed to as what bylaws are often a reflection of is what's meant by this idea of taking culture into consideration. Next slide, please. ZEP observed that the accrediting agencies, several accrediting agencies require a review every 3 years. So this notion of the periodic review is enshrined in accrediting regulations and rules as well. So bylaws are rules that you've actually created to guide your work. They should have a compliance responsibility, so they're mindful of legal requirements that, as Zeb observed about the accrediting agencies. Language that enables rather than restricts or prescribes is useful in bylaws. So a reflection of what you're empowered to do as opposed to what you're restricted from doing should be captured in bylaws. There are templates and examples of bylaws, by the way, that may be available to you, and they're model sets of bylaws that this is not like reinventing the wheel. It's not that kind of exercise. So bylaws that govern your health center don't have to feel like a mystery. I think the observation that you should keep them simple so that they're understandable and even brevity as opposed to complex legalese or jargon would be a useful consideration for the bylaws and how they're structured and how they read. This notion for a regular review, again, is a clear consideration for how best to organize bylaws. It's observed that the same goes for articles of incorporation by the board of directors. The idea and the guidance that you restrict the details for policy pronouncements and not bylaws enshrines this notion that policies are more easily revisable. Policies have a different level of scrutiny, and they're developed differently than bylaws. So bylaws are not meant to be the focus of constant attention and consideration. Clearly, you have to always operate in compliance with those rules that you've agreed to operate under, or else it makes them kind of a meaningful exercise that's only for show and not for use. To the extent that you set your bylaws aside and operate outside of what you've agreed to, it makes your organization an unreliable institution that is likely to be not be a very well-run structure. So that compliance is important. So writing bylaws that are easy to understand, interpret, and comply with is a key to that idea of operating under the rules that you've created. Next slide, please. A few more considerations about bylaws. It's important to understand that bylaws are legal. This means that legal requirements are part of what they include. And those requirements can change based on the jurisdiction you operate in. But you should always be aware of the need to be mindful of local regulations that you need to comply with, whether it's routine reporting mechanisms, articles of incorporation, or other kinds of regulatory mechanisms dictated by your state, your city, or your county. Finally, as noted earlier, well-drafted bylaws should be flexible and not require regular amendment. In fact, if bylaws are a focus of constant deliberation and there's an ongoing debate or controversy about revising them, then it's probably not a healthy or productive discussion that boards need to be engaged in. If that kind of revision is called for, it should be relegated to people with the appropriate expertise or a subcommittee of the board so that it doesn't become an all-encompassing controversy to have regular conversations about the bylaws and what they do or don't contain. That's not a productive way to take advantage of the expertise of your members. So finally, I think that that final bullet here about getting assistance from qualified professionals, particularly those experienced in nonprofit governance, might be an answer to some of those concerns where there is any kind of concern about the bylaws, their flexibility, their interpretation, what have you. getting help when you need it is always going to be appropriate. So get the help of experienced folks. Turn to other UIOs and ask them about experts they may have relied upon. Don't be afraid to operate on the peer-to-peer principle that we operate under to generate our communities of learning. And we rely on sister organizations that face the same kind of challenges we face. So reach out and find the expertise you need when you need it. That's an important consideration for bylaws themselves. Next slide, please. I'd inserted this as a reminder of the compliance manual and the Hersa document that drives compliance, particularly for our fairly qualified health centers. Zep, did you have any observations you'd like to make about the manual or compliance issues governed by the Hersa process?
Yeah, actually, I can chime in for a little bit here with regard to the Hersa requirements for organizations that are an OUIHP as well as a Section 330 funded grantee. Usually what happens is that, as you guys might know, is that Hersa has two different chapters. There's the board authority, which is shown here, and then the board composition. If you write for a waiver, because the office, the OUIHP office, if you write for a waiver, you can apply the board composition to be replaced by the OUIHP board makeup. So as you guys know, it's 50% AIAN board members that would be sitting in on the board versus the Hersa board composition, which would be, those folks who get 50% of your board members would get care from your facility. So there's just that distinction in this piece. I don't see that the OUIHP site visit manual was screenshotted, so I can go ahead and put that link in the chat box for you guys as well. And I know that this is currently being updated. So just give me one moment here.
Go ahead.
So that's where you guys can find, again, the IHS OUIHP site visit protocol as to what they're going to be looking for the site visits, again, as you know. But I just wanted to throw my 2 cents in there so that you guys are aware of that distinction between Hersa board composition and authority, and then also the OUIHP standards for governance as well. That will trump, again, the Hersa board composition chapter.
Thank you,
Zep, I had a question, sorry.
Sure.
So the link that you just provided, so I hear of like this IHS like manual. Is this what it is? Like
Yes.
for how to operate our board?
Yeah.
Oh,
So that's
okay.
what they're going to be looking at. If you'll notice that when you go through the OUIHP manual, it'll have different sections, just like makeup things that are listed that they're going to be reviewing with you guys at the site visit.
Okay, all right, thank you. This is helpful.
Thank you, Zep. Can we go to the next slide? This is the Health Center program site visit. What this screenshot is meant to display, by what I've circled in red, is the importance of 2 things. Documents provided prior to the site visit, and you'll notice that bylaws are circled. And if you read the fine print, it says if they're updated since the last application in particular. So bylaws are put on the checklist for that site visit. So there's going to be a scrutiny and oversight of those bylaws as you've created them. And then look a little bit further down for documents provided at the start of the site visit. And the very first thing they mention is board minutes. So this notion of these, while they feel like mundane, everyday kinds of documents that you're creating, they really are important and they serve a purpose. That's enough said about the board minutes and bylaws in particular. Next slide, please. A few online resources. Again, these will be available to you in the PowerPoint for information on bylaws. One valuable resource for nonprofit governance is an organization called BoardSource. There is a paywall for accessing some of their materials, but they do have a nice collection of resource materials. The Council of Nonprofit Boards offers tools and resources for bylaws that are free of charge. And then finally, the Directory for Charities and Nonprofit Organizations, the link there is to a really large directory of nonprofits, and foundations are included in there. It's a useful directory, and there's a subset of the directory information that may be useful for looking at governance tools. Next slide, please. This last topic we're going to tackle, and we're at 2:44, so we'll tackle it quickly, I promise you, is taking effective minutes. Next slide, please. What is the definition of minutes? They could often be called meeting notes. They're literally the written record of things that happened during the meeting. They're not the same as the meeting agenda, but they're guided by the order of topics presented in the agenda. They're not meant to be a minute-by-minute record, and they're definitely not a transcript. So don't confuse the minute taking with transcribing. They're not the same thing at all. Next slide, please. So in thinking of the minutes as in terms of competencies involved and the overall process, it's useful to think of what you do prior to taking your minutes, what you do while you're taking minutes, and what you do after the minutes have been assembled. So these next few slides offer a kind of checklist or insight into those 3 moments of time. So before you begin your minute taking or before the meeting starts, what are some things to be mindful of? Be aware of the layout and style of minutes. That can be accomplished by a review of previous minutes that have been accepted and approved by the board. So being mindful of what the minutes will look like when you're done with them is really helpful. Reading the minutes of the most recent meeting might be a helpful process to get you grounded in not only the flow of how the minutes or how the meetings have gone, but the hot topics that may come up in this meeting and where people will expect you to pay close attention to action items, particularly recording decisions that are made. And then finally, are you conversant with the agenda itself? And this is particularly true for those meetings that you have a lead time and agendas are shared in advance. You owe it to the folks you're taking notes for that you're clear on what their meeting is about and the purpose of their meeting. So do you understand the agenda is a question you must ask yourself before you begin taking minutes. Next slide. During the meeting, what are some things to reflect on? Are you extracting and recording decision points and action points? Again, focus on decisions to be made as opposed to discussions that are leading up to the decisions is what's pointed to there. For the action points, you need to ask yourself if you're clear on who is responsible for the actions. Are there deadlines associated with actions? What kinds of ways is completion dictated by the board discussion about the actions to be taken? And this is an important aspect of minute taking. When a point is unclear, how do you clarify the need to make the point clear, particularly if you're going to record an action? Is it appropriate for you to raise your hand as the note taker? Do you nudge somebody under the table? What do you do to get folks' attention to say, hey, I didn't quite capture that last action that was discussed, and I'm trying to record it accurately for our minutes. So even a procedural question about how that's done might be something the note taker needs to find out in advance. And then finally, if you see yourself writing full sentences or trying to look at abbreviation, grammar, construction, and paragraph construction, as opposed to bullet points, abbreviations, even shorthand, then you've missed the point of what the minutes should be about. Again, this is not about writing sentences. This is not about lengthy narrative. This really is about bullet points and phrasing. Next slide, please. So now,
and just really quickly, Mark, sorry,
yes.
Cherie did comment in the inbox that she uses a recorder during the meetings as well, so that helps them out.
That is useful, particularly for clarifying discussion points. There's an important proviso about recordings, and we'll kind of get to that in our closing remarks. There's a best practice that means that those recordings and alternate notes of the proceedings of the meeting had to be carefully monitored, that they're not confused with the legal approved notes that are the official summary of action of the board. So just you have to take care when you have those alternate recordings and alternate notes. So after meeting, have you discussed the pertinent points with the chair of the meeting, particularly like initially right in that meeting room as quickly as possible to the action? This is where it's kind of a time sensitive activity. Have you checked on the level of detail that the particular meeting requires? Have you gotten everything you needed to have? And do you have all the pertinent items recorded so that when it's time to complete a final draft of your minutes, you don't have to call around and ask about who said what's that person's title, did this person say that, or did this person say this? So finally, have you started writing up your draft minutes as soon as possible after the meeting? Again, a good practice for the note taker is to not let too much time elapse, to let those notes get stale, and the little marginal comments and squiggles and arrows and whatever things you used as a guide to your note taking lose their meaning over time. The sooner you get started on writing up those minutes, the more accurate they're liable to be. So next slide, please. So then what should be in the minutes? Again, similar to the agenda, the title of the group, the meeting, the date and time, where you met, the names of those in attendance, particularly staff persons as well. And obviously the recorder of the minutes should all be reflected in the minutes. And of course, a copy of the agenda should be an attachment. It's important that the minutes follow the basic order of the agenda without necessarily being a recap of everything that's in it. To the extent that there are summary statements made, again, they don't need to be fleshed out, lengthy narrative. In fact, you would want to avoid being overly prescriptive in your language, describing each and every informational chunk of the meeting. It's not your role as a note taker to restate what's said in those big Roman numerals on the agenda. You're filling in the little details and the actions, not describing the big chunks of information that are described and labeled in your agenda. So be clear on what those summary sentences do and don't do. Next slide. Now, what shouldn't be in the minutes? Remember that minutes are public documents, and they can be available for review. And those people who make minutes should be clear on what they're expected to exclude. And maybe that's a discrete conversation with the convener of the meeting. It might not be immediately clear to you by reviewing previous minutes about those kinds of discussions about what was excluded, obviously, because it was excluded. So this idea of, hey, what are the boundaries of my note taking? What's the practices that the board is comfortable with? Should be a discussion that a frank discussion that you have with those people who are convening the meeting, and probably before the meeting makes more sense than afterwards. You don't want to have an awkward discussion after you've tried to be accurate with minutes, and it hasn't worked out the way you wanted to as a minute taker. Minute taker should avoid direct quotations. Even when the name of a person is not used, those in attendance with the meeting will know who said that sentence, and they may recognize even the phrasing of the sentence. So avoid direct quotations. They don't belong in your minutes. Don't report on specific details of discussions. Again, as a reflection of who said what to whom. This is not a transcript. It's not meant to be that kind of reflection of discussion. When there are items that are not on the agenda that are discussed, and particularly if there's a lengthy discussion about topics that are not on point, it's okay to note that time was provided for discussing items that were not on the agenda. Because remember, the agenda is going to drive what you reflect. Not every sidebar conversation, not the when the discussion meandered, maybe in a way it shouldn't have. You're driven by what that agenda is asking you to record. So that statement, time was provided for members to discuss items not on the agenda, could be very useful. A note in the chat box said executive sessions are often excluded from note taking. That's a great observation. Thank you. Then finally, once the minutes are approved, the notes, the audio or video recording of the meeting, some folks say they should be destroyed. Now, what's important is that there's only one official version of the final approved minutes, and there shouldn't be any confusion about that version. Once they're accepted and approved, and again, because they do adopt a kind of legal status, it's important that there not be any ambiguity about what happened at the meeting and what was decided at the meeting. So that in that way, you don't have controversy or arguments continue by having other kinds of sources that may fuel a dispute about what's the officially approved version of meeting action. Because once those minutes are accepted, they do have that force of everyone agrees this is what was decided. So keep that in mind about alternative record keeping. Next slide, please. A few other considerations about minutes. I think it's really important that when you discuss legal matters, particularly matters about compensation, human resources, court concerns, liability concerns, that you're clear on what should not be a part of minutes. The substance of legal discussions or privileged advice given by legal authorities is really not a focal point for what should be in your meetings. In fact, this is particularly true about minutes about compensation or board compensation. They're often going to be had in a subcommittee session anyway, where the regular minute taker may not be the person charged with recording the proceedings. In general, the practice of recording abstentions is not done where people are enumerated who chose not to vote. It's that kind of recording of votes is not a matter of your regular routine record keeping. So the idea of recording those who abstain or opposition votes is certainly not required. Now, should a member request it? I think that's a point of order that the note taker shouldn't be asked to make a decision about. It's not in the purview of their authority about that kind of request. So perhaps a parliamentarian, perhaps someone else with greater authority on the proceedings of the board would respond to that kind of request about a request to be specifically enumerated in the minutes as opposing a position or a motion made by the board. Next slide, please. So, for a few resources on minutes, and this checklist for minutes is an interesting, very lengthy checklist that gives you all sorts of considerations about what a minute taker might rely on as a sort of guidance. There was also, there's some helpful resources for first-time note takers. This introductory session on YouTube about minutes and note-taking, I found very useful and instructive. I'm sure there are other places on YouTube or places that a web search would reveal for similar kinds of instruction. So these are not meant to be some sort of exhaustive or authoritative review of everything available about minutes, but just a few items that are resources that were relied upon for the tips and considerations we've discussed today. So here we are at 2:58 with our questions and answer period. We committed to have you here from 1 p.m. to 3 p.m. I am going to turn it over to Zep to march us through our final section here. Thank you.
Thank you so much. Thank you so much, Mark. I know that we've only got like a couple of minutes. We've only got like 2 minutes remaining, but I wanted to just feel the floor, see if there were any remaining questions that you guys might have. Feel free to unmute yourselves to ask any questions that you might want to ask.
Zach, this is Carol DeHosey at Native Health.
Yeah, hi, Carol.
Hi, I really agree with your comment about the accreditation standards that are the clinic work is being held to. And right now we are trying to see how we can incorporate that piece into our into the consent agenda maybe, or maybe have it as a separate agenda item so that we know that the operations are in compliance with all of the accreditation standards. Any thoughts on that?
Yeah, so I know that when I was there, I tried to create a crosswalk that reflected the similarities and standards so that the team wasn't feeling like they were doing like duplicate work for the same standard. I would recommend definitely looping in a strategic scorecard, if you will, and that's one of the sessions that I'll be facilitating for, I believe, webinar 4. I'm going to go ahead and just put in the chat box the upcoming sessions link. And if you guys could just bring that up, Noel, if you're able to pull that up on the screen and share the screen with the attendees, that would be great. That question would be addressed in that session. I'm hoping to see how we can create several dashboards that speak to the accreditation standards or even the site visit survey requirements as well. So that idea would be coming to you in a format as well. And I know we also do have a handbook that we're creating, or a conference program, if you will, where we'd be sharing a best practice from one of our other UIOs, Indian Health Services of Santa Clara Valley. They did a very well done job on creating a scorecard that includes metrics that align with their strategic plan. So that's one of the upcoming sessions as well. And if you could quickly scroll down here. So the upcoming session is going to be this coming Friday. So we do have a facilitator coming on board who's going to talk about thinking ahead, emergency strategic planning and succession planning during COVID. So we're going to talk about a focus on the next 6 to 12 months. What does that look like? How will the board prepare for it, as well as leadership within your organizations? You'll be discussing key elements of strategic planning as they relate to emergency planning, including possible contingency succession planning to enable your organization to best serve your patients during COVID-19. So that's going to be a really good session. And that we did contract with a really amazing facilitator. Her name is Joanne Schlosser. She has over 15 years of healthcare experience and has taught executive success skills in an MBA program. She also does a lot of talent and organizational effectiveness for the local Banner Health hospitals here throughout Arizona. She's also well-versed in leadership development, change management, coaching, organizational development, and serving on an administrative team for 3 different hospitals currently. And she's also the author of a book called Big Book of Team Coaching Games, Quick and Effective Activities to Energize, Motivate, and Guide Your Team to Success. And then moving down to the next session on Monday, October 26th, which is coming up this Monday, it's going to be Understanding Finances for Non-Financial Leaders. And the objective of this is interpreting financial statements and financial reporting needs for the boards. And that particular speaker is also coming a definite powerhouse. So Lori Lender is a healthcare executive with over 37 years of broad leadership experience in a multi-site health system. She served in various roles as Chief Financial Officer and Chief Operating Officer. She was a CFO for a 700-bed hospital campus for a multi-site health system, and she managed a budget of $1.8 billion in revenue and $518 million in total expenses. And she also was an early adopter of national benchmarking processes that led to a focus in productivity, reducing expenses by several $1 million. So I would highly encourage you guys to get your finance committees to attend that, because it's going to be a really good session. And if you scroll down, October 30th, Friday, that's where I'll be facilitating that session on how to develop board of directors metrics and how do you tie that to your strategic plan. So that basically, again, is going to introduce the use of evaluation metrics and assessment tools that you can integrate into your performance measurement in addition to your strategic planning. So Carol, I hope you're able to attend that session so that way I can share those scorecards with you. And then the next session is going to be the board self-evaluation tools. We have another guest speaker coming in. His name is Tony Scucci. He's an organizational and clinical consultant in a private practice with more than 35 years of experience in the nonprofit sector. And he's been assisting NCUIH for a little over 30, he's assisted a little over 30 urban Indian health centers and has worked closely with NCUIH for the past several years, and he's led facilitated strategic planning sessions as well as, and in addition to executive coaching. Sorry about that. So he's going to be facilitating that session. And then the last session is going to be held on Friday, November 6th. And that's going to be the Indian Health Service tools for urban programs. And that's just how do you prepare for a site visit for OUIHP. So again, if you guys could attend that, Rick Mueller, I'm sure a lot of you guys are familiar with him. He'll be facilitating that session as well. Some more details will come. So if you guys could share amongst your board of directors, these are really exciting sessions that also will tie in that COVID-19 infusion, if you will, on how do you plan, you know, in the event your providers are all out, or, you know, in the upcoming wave 3, what does that look like if your CEO gets sick? You know, your CFO, do you guys have a plan for that? Or your medical providers? I know a lot of urban Indian health centers have, you know, maybe like a handful of MDs and the rest are like physician's assistants. How do you plan for that? How do you make sure you have enough cash on hand? Again, for the upcoming months, are you sure you guys have enough PPE on hand? So this series was really tailored to addressing some of the IHS listening sessions that we've had in addition to CDC, and your teams have, you know, made comments as to things that they needed help with. And so we really tried to build a curriculum that could actively get you guys engaged with some of the topics, as well as provide you with some resources and tools. We've also introduced a new one-on-one concierge NCUIH technical assistance program as well. So even if you guys wanted to talk with Dr. Mark or myself outside of today's session, we'd be more than happy to go over some of the elements that were presented in today's session as well. So please do not hesitate to reach out to either Mark or myself to schedule those. But aside from that, I just really wanted to catch you guys up on that. But aside from that, are there any other final questions? And does that answer your question, Carol?
Yes, it does. Thank you.
Sure. If there are no questions, we can definitely adjourn. And we do apologize for going over time, but we so appreciate your participation and welcome and invite you guys to the next upcoming sessions. Have a great day, guys.
Thank you, everyone. Have a good day.